Recording. There we go. All right. Well, hello, everyone, and welcome. We're so glad you could join us today for our Medicare Learning webinar. Whether you're just starting to explore your Medicare options or you're looking to better understand what's available, you're in the right place. We're keeping things very informal today. This is meant to be a relaxed conversational session. So please feel free to ask any questions at any point in time. You can drop them in the chat box or ask mid-presentation, and we'll make sure to get to as many as we can throughout the session. Today, we're extremely excited to welcome Nancy Glicksman, a highly respected Medicare specialist with Alera Group. Nancy brings a wealth of experience in helping individuals and families navigate the often complex Medicare landscape. With deep knowledge of both the regulatory environment and real-world needs of clients, she's passionate about education and empowering people with clear, accurate guidance. Whether you're approaching eligibility, supporting a loved one, or simply want to better understand your options, you are in great hands today. Nancy will be walking us through what you need to know, from the enrollment periods and plan types to cost considerations and coverage options, all with a focus on making you make more confident, well-informed decisions. So again, do not be shy. Jump in with any questions at any point in time. And with that, we're happy to turn it over to Nancy Glicksman. Nancy, thank you again so much for your time and your expertise. We greatly appreciate it.
Absolutely. Thank you for letting me share this information with your clients. So, like Kate said, I want this to be very informal. I know how confusing Medicare is. Insurance in general is very confusing, and Medicare, it makes it much more difficult. So, I want you to feel free to ask questions as they come into your mind so you don't forget them. And I'm going to try and break it down into really bite-sized pieces. So I want you to be able to get a basic understanding. So without further ado, just a few things about me. I am actually a clinical social worker by training. And when we relocated to the Pittsburgh area a little over 23 years ago, I thought I wasn't going to work. And I didn't know what I wanted to be when I grew up. And then I answered an ad on monster.com. I don't know if you guys remember monster.com. And it turns out it was for insurance. I knew nothing about insurance. I didn't know what a deductible was. I didn't understand any of the terms. So I went through, you had to get certified, and I taught myself everything. So I am very passionate about making sure people understand how things work because it can be very confusing. So, today, what I want to do is talk about what Medicare is. And there's a lot of confusion. Do I need to enroll in Medicare? How much is it going to cost? How does it work if I have other coverage like group coverage or individual coverage? And then also, how do you get Medicare? How do you go about enrolling? When do you need to enroll? And also, what are your different options? So, first, we're going to start with what is Medicare. And some of this might be a review for some of you. But Medicare is primarily for people who are 65 or older. Now, a lot of people start, well, not a lot of people, but you can start collecting your Social Security at 62. So people think they're eligible for Medicare at 62. That is not correct. It is the age of 65. And you are eligible the first of the month in which you turn 65. So if your birthday is July 15th, you're eligible July 1st. Medicare is always effective the first of the month. The only exception is if your birthday falls on the first of the month, you're eligible the first of the preceding month. So if my birthday was July 1st, I would be eligible June 1st. Every other day, it's the first of the month. Now, there are certain younger people who are eligible for Medicare based on different types of disabilities. So I do have clients who are under 65 that are on Medicare. Also, if people have a diagnosis of end-stage renal disease, kidney disease, or ALS, which is Lou Gehrig's disease, they are automatically eligible for Medicare as well. Medicare has a lot of different letters. There are two main parts of Medicare, and they call that original Medicare. Part A and Part B. There are no options for A and B. There's one Part A, there's one Part B. A is your hospitalization. It's anything, some people think of A for admit, anything that requires an admission, like inpatient hospitalization, inpatient rehabilitative care, hospice care. All of that falls under Part A. And Part B is outpatient medical care, like your doctors, your specialists, your outpatient surgery, your rehabilitation, your testing. All of that falls under Part B. So those are the two original parts of Medicare. And we're going to get back. I'm going to talk about them in more detail. So the first question is always, do I need to enroll in Medicare? I can't tell you how many calls I get. My friend told me I'm going to get in trouble. I'm 66 years old. I don't have Medicare. And I always ask them a series of questions. Are you a full-time employee? Do you work in a company with over 20 people? Do you have credible coverage? So certain people do need to sign up for Medicare when they're first eligible, and others do not. So let's look at a few scenarios. Number one, let's say you're working and your company has over 20 employees. In that situation, as long as you're an active full-time employee, you can continue on your company coverage and you could delay signing up for Medicare until you're planning to retire. Now, some people on company coverage decide to still work, but to go on Medicare instead of the company coverage. And I'm going to go through some scenarios a little further down in the presentation as to comparing which is better. Do I stay on my company coverage or do I go on Medicare? But the bottom line is if your company is over 20 people and you're an active full-time employee and your coverage is credible, you can delay enrolling in Medicare. Now, again, feel free to ask questions. I want to cover a lot, but I don't want to lose anyone. If you work for a smaller company with under 20 employees, or if you're self-employed, you do need to enroll in Medicare when you are first eligible. There is something called MSP, and I don't want to get too technical, but it stands for Medicare Secondary Payer Rules. What happens is Medicare doesn't want to have to pay if they don't need to. So in 1980, Congress passed a law that said Medicare is secondary to certain things. Well, Medicare is secondary to group coverage for over 20. So that's why the group pays first. But Medicare is primary for companies who have under 20 people. So that means if you have under 20 people, Medicare is primary. If you do not have Medicare A and B, your claims will not be processed in full. I got a call from a gentleman who's a physician who has a very small practice. He has very good coverage with UPMC. So he thought, I'm not going to enroll in Medicare. I have great UPMC coverage. There's only like 7 people in his company, so it's under 20. He had cataract surgery and he got a bill, and only 20% of his claim was paid. And I said, do you have Medicare A and B? And he said, no. And that's why UPMC only paid 20% because they want you to have Medicare paying the 80%. So it's very important in those situations. And the carriers, especially UPMC, are following through. So if you have under 20 employees, even if you want to stay on your group plan, you need A and B. Now, if you're planning to retire, you absolutely need to enroll in A and B. Some companies offer COBRA, which is a continuation of current coverage. If you are 65, you need A and B because Medicare is still primary. So the only time really you can delay it is when you're in a company with over 20 people and you're working full time. Everyone with me? Okay. I want to touch upon health savings accounts because it gets a little tricky. I don't know how many of you are familiar with HSAs. A health savings account, when people have a high deductible health plan, they can put money aside tax-free into this account, and they can use that money to pay for medical expenses. And sometimes when you get to a certain level, you can actually invest the money in the HSA. But I'm not talking about that because I don't know enough about that. But with an HSA, if you are on Medicare, you may not contribute money into a health savings account. So when people call me and say, should I enroll in Medicare? I'm still working. I'm on a high deductible health plan. I always say, do you have a health savings account? Because if you do, I always say, don't enroll in A or B. Because by enrolling in A, you may not contribute to your HSA. You can use the money in the HSA, that is still your account, but you may not put more money into the HSA. Now, this is something I was just telling Kate. I just heard today. I have nothing in writing on it, but something new might be changing in terms of HSAs because of the big, beautiful bill that was passed. One of the changes, which actually I think will be a good change, if this is indeed what happens, once that takes effect, I believe you can contribute to an HSA when you're on Medicare. So, more to come on that. Again, I just heard it. I haven't seen anything in writing, but I believe that's one of the changes that would be a positive. So, in that situation, people on Medicare would be able to contribute to an HSA. Now, do any of
Yeah,
you have employer coverage currently? Because
that's
one
the
of the, I,
question.
I'm
I asked a quick
sorry.
question. Ask a quick- So if someone turns 65, I'll be 65 next year in 2026.
Okay.
And usually the first thing I do in the first week of January is fund my HSA. Because I'm turning 65 in the year of next year of the year that I'll be funding it, should I make that contribution or is it the following year I might be ineligible?
So here's the deal now. Like, let's forget about the change that might come.
Yeah.
Okay. Because I don't know enough about that. As it stands right now, and what I've been telling people is if you're turning 65 during that year, I would not put the full amount in. So if your birthday is in July, I would just contribute half of a year's amount. Because what's going to happen currently, if nothing changes, when you eventually apply for Medicare, if you are older than 65, they will backdate your Part A effective date 6 months, up to 6 months to your birthday.
Hmm.
So, like, let's say your birthday is in July and you decide the following January you're going to apply for Medicare. You're going to have your Part A go back to July 1st, which means you shouldn't have funded your HSA past July. So in advance, I always tell people currently do not fund the full year, prorate it up to when you're going to turn 65.
Got it.
But again, that might be changing, but
Yeah.
that's what I say now.
Okay.
Okay. Now, I do a lot of groups for employers, larger employers, because people want to know, should I go on Medicare or should I stay on my employee coverage? And when we look at that, I have them look at different things. Some people pay a monthly contribution for their group plan. So we look at, what are you paying currently for your group insurance? What is your deductible? Do you have a high deductible? How large is it? And what is your maximum out of pocket? If you take nothing else from this workshop, one thing I want you to understand is that term, maximum out of pocket. That is a number which means, God forbid, something catastrophic happened and you had to go into the hospital and maybe you need chemo or you need treatments. That is your bottom line dollar coming out of your pocket in the course of a benefit period. All plans have maximum out of pockets. So your company plan has a maximum out of pocket. Medicare Advantage plans have maximum out of pockets. I want to know that maximum out of pocket tells me that is your maximum exposure for your healthcare needs in the course of a year. And that's an important number. I mean, most people never reach it, but you want to know, God forbid, if you did, you're okay. So I have people who are working tell me, what is their deductible? What is their maximum out of pocket? What are they paying each month? Do they have other people on the plan? Is there a spouse on the plan? Is there a child on the plan? So we look at different variables to see, should I go on Medicare or should I stay on my company coverage? Um, so let's talk about enrolling in Medicare. How do you enroll in Medicare? The first thing to know is Social Security administers Medicare. So when you're enrolling in Medicare, you do it via Social Security. Now, if you're collecting your Social Security, when you become eligible for Medicare, you will automatically be enrolled in Medicare A and B. You don't have to do anything. 3 months before, you're going to get a card in the mail. It will be your Medicare card. The tricky part is if you're taking Social Security and you're already on a company plan, you don't necessarily want to keep Part B because you have to pay for Part B. And I'm going to tell you about the premiums in a minute. But so you have to tell them you don't want Part B if you don't want it, because otherwise you will be enrolled in A and B automatically if you're enrolled in Social Security. If you are not enrolled in Social Security, you have to apply. The easiest way to do it is to do it online, and the website is ssa.gov. There are a lot of other websites out there that try to mimic this, so it's very important to make sure you're on the correct website. www.ssa.gov. Now, if you do not have an account on ssa.gov, even if you're not Medicare eligible, I would strongly recommend creating an account on ssa.gov. It helps prevent identity theft. I used to work really closely with a woman from Social Security who retired, unfortunately for me. But she used to tell a story about this grandfather who took care of his grandson and did everything for this grandson. And the grandfather decided he was going to delay taking his Social Security just so he could maximize it. So when he went to apply for Social Security, he went online to do it. And they said, you've already been collecting your Social Security. Well, his grandson was taking it for him. So, and he would have known that if he had an account online. So you can really monitor things. So again, even if you're not 65, like I created an account at 50. You go to ssa.gov, you create an account. It's going to ask you security questions. Some of the questions are tricky. And then you could create an account. You just want to make sure you know your username and password because it is hard to reset it. But once you're eligible for Medicare, 3 months prior, you could go into that account and you'll see it will say Medicare application and you can apply. You could apply for Part A only, like if you're still working and you just want Part A, or you could apply for A and B. So that is the easiest way. You can always call Social Security. I have their 800 number, which is their national number. You don't want to call on a Monday or a Tuesday morning, but they can be helpful. Or you could go into a local Social Security office. Certain offices are better and more welcoming than others. I have my clients bring donuts when they go. You have to be creative. They can, I guess some people have turned people away, but I always tell people to get very melodramatic, like, oh, I need your help. Don't leave. Bring donuts and don't leave. So I'm skipping that one because that one you don't need to worry about. Okay. So let's say everyone always talks about what if I don't enroll when I'm first eligible? Am I going to have a penalty? Now, there is a penalty if you do not enroll when you're first eligible, if you do not have credible coverage. So remember, there is no penalty if you're 67 and you're still a full-time employee in a company with over 20 people. But if you're not in a company with over 20 people, or you're working very part-time, and you do not enroll in Part B when you are first eligible, you will have a 10% for each 12-month period that you did not have Medicare. It will go retroactive and it will stay with you for the rest of your life. So you definitely want to make sure you enroll when you need to if you do not have other credible coverage. And there is also a 1% penalty if you do not have Part D coverage, which is prescription coverage. And these penalties stay forever. So I have people who come to me and say, you know what, I'm not going to get a Part D plan. I don't take medications. I get my drugs through GoodRx. And I'm like, oh, you're getting a prescription drug plan. Like there are plans for very little money. You need to make sure you get the coverage when you are first eligible to avoid any penalty. Okay, let's talk about costs. Part A, your hospitalization. As long as you or your spouse has worked at least 40 quarters or 10 years and has paid into your Medicare taxes, there is no cost for Part A. So you would pay nothing for your Part A. And that's why some people who are working get Part A and keep their company insurance because they're not paying for Part A. Now, if someone has worked less than 40 quarters, there is a premium, but that tends to be unusual. Again, Part A covers you in the hospital, inpatient mental health, skilled nursing, and hospice care. Now, this shows you costs like there is a deductible, but you wouldn't just have Part A. So I'm not going to really go through this. You're not going to worry about this Part A deductible or costs per day because you either will have Part A with a company plan or you would get a supplemental or advantage plan that would get rid of all of that. So the important thing to know with Part A is what it covers And hopefully there's no cost for Part A. Part B, there is a cost. And that's why, again, if you're working and you have credible coverage, you have over 20 employees, most people delay getting Part B. Part B in 2025 costs $185 a month. That number goes up every year. The new numbers are released by the government sometime in October. I want to say last year it was like 174.70 or something. So it does go up every year. Now, there is something called IRMA, which stands for Income Related Monthly Adjustment Amount. Some people pay more for Part B. 185 is the standard amount. But what happens is they're going to look at your modified adjusted gross income. They're going to get a copy of your tax return. And the tax return they can get access to is 2 years prior. So they always look back 2 years. So if you're applying for Medicare in 2025, they are looking at your 2023 tax return. If you file individually and you make more than 106,000, you will pay more for Part B. And depending how much more you make, depends how much more you pay. And if your joint income is above 212, the same is true. So I have clients, instead of paying 185 a month, they're paying 628.90 a month, which is pretty significant. You also pay a little more for Part D, which is your prescription drug coverage. So there's IRMA for Part B and IRMA for Part D. And this is billed by Social Security. No matter what else you do, this is a given. And it's always a 2-year look back. So in 2026, they're automatically going to go to your 2024 and adjust it. So they always readjust it based on that 2-year look back. And like if you're married and you didn't work, but your husband was the one who has all the income, it's joint income. So you both will have the IRMA. Now, there is something called an IRMA appeal. And there's a form. It's a very fair process. And most of my clients either lower their IRMA or eliminate their IRMA. One of the things, you have to have a qualifying event. And if anyone's interested, I downloaded the form. You could get it on Social Security's website. One qualifying event is work stoppage or reduction of work hours. And you could show they're looking at 2024, but in 2026, you're not working. So now your income's a lot different. So they will take that into consideration and they will adjust it. But you have to do the appeal form. And you would have to do it for you. And if you have a spouse, you would have to do it for your spouse as well. And the following year, if it's still going to show high, you have to appeal it again, even if you won the appeal. Because remember, they automatically look back the 2 years. It's an easy form. So it's not a complicated thing. It's a thing, unfortunately, you have to do. And you want to do it before they start, billing you for the Part B. Any questions on that? Okay. Now remember, Social Security is who administers Medicare. So when you are taking your Social Security, that 185 or whatever that 185 in IRMA and your DIRMA will automatically come out of your Social Security. If you are not taking Social Security, you will get a quarterly bill in the mail from Social Security for that amount. If you don't want to pay a quarterly bill, there is a way you could go to a website called Medicare.gov, create an account, and pay it monthly out of a checking account. But again, if you're not in a company with over 20 people and working full time, you definitely need A and B. And no matter which way you go once you have A and B, and I'm going to get into that next, you still need Part B. And if you have IRMA, you still have IRMA.
Nancy, one question. We've had this question come from a client before. Those premiums cannot be paid with HSA funds, correct?
I believe the Part B can be paid with
Can it?
HSA.
Okay.
Yes. I will check that, but I am almost sure the only thing that you cannot pay use your HSA for is Medigap premiums.
Okay.
Let me just quickly look. I'm almost sure you can pay your IRMA and Part B with your HSA. Let me just look real fast. Okay, so
On the fly.
so
This is
you
I
can
know.
use your health savings account for certain Medicare premiums, including Medicare Part B and D, also your Part C, which are Advantage plans, which I'm going to talk about, but you may not use it for your Medigap premiums.
Got it.
I think you can use it for IRMA too, because that's part of your Medicare Part B.
Okay.
I'm just confirming that so I don't give you wrong information. Yep, you can use it for the IRMA. Yes,
Okay. Thank you.
sure. Okay. All right. So what does Part B cover? Part B covers your doctors, outpatient surgery, ambulance, blood work, durable medical equipment, all your rehab like PT speech, preventative care. And one thing people don't think of that is included in Part B are Part B medications. These are medications that are administered in a hospital or in an infusion center, like chemo. You're not picking them up at the drugstore. Drugstore is Part D. Think of D for drugstore. Part B medications are medications you're getting inpatient in those type of settings. So that still falls under Part B. If you just had Part B, which you wouldn't, there's a deductible this year of 257, and then you're covered at 80% coverage. So if you just, let's say you're not working, you need to get Medicare. Should you just get A and B? No. And I'm going to tell you why. You need more than just A and B. If you just had parts A and B, there would be no out-of-pocket maximum. You could pay 20% of God knows what. You would have no co-pays. You're always going to pay 20%. You would have no prescription drug coverage, and you would have no extra benefits like dental, vision, or anything like that. So having parts A and B is not enough if you're not working. So there's two different ways you could go. Again, you're not working, you need Medicare. The first thing you're going to do is get parts A and B. And then you could either get what's called Part C, which is also called a Medicare Advantage plan. These are the plans you see advertised on TV all the time, especially during annual enrollment. You have UPMC for life, you have Highmark, you have Aetna, you have Humana, you have Cigna. There's a lot of different carriers. Each of them have like 8 different plans. They wrap everything together into one plan. But again, you need to have A and B in order to get these plans. These plans include prescription drug coverage, and a lot of them include dental, vision, hearing, gym memberships. There are HMO plans, which means you have to stay in the network unless it's an emergency. And they have PPO plans, which give you the ability to go out of network for non-emergencies. So that is one way to go. You have Part A and B, and then you get a Part C plan. These plans change every year. And that's why they have this period coming up that you see advertised called the annual enrollment period. People get information on how their plans are changing. They look at it and they decide, do I want to keep it the same with the new plan design, or do I want to change to a different plan? And they have a window of 6 weeks, and then the new plan would start January 1st. The new plans have not been released yet. They're going to be coming out. I'm going to find out about them, unfortunately, probably late September. And I'm expecting some big changes, honestly, in the plan designs. I think they're not going to be as rich as they are currently. But currently, you could get a plan, a Medicare Advantage plan for $0. I'm not allowed to say free, all the way up to $50. So you're going to pay your $185, let's say for your Part B, if you don't have the IRMA, and then you're paying for your Medicare Advantage plan. So that's one way to go. The other way to go is to get what's called a Medigap plan. It's also called a Medicare supplement plan. And it's exactly as it sounds. It fills in the gaps that Medicare doesn't cover. So with a Medigap plan, Medicare is primary. And remember, Part B covers you at 80%. Here comes that Medigap that fills in the 20%. With a Medigap plan, there's different letters. They like to make it very confusing. Most people look at a plan called Plan G, like George. I'm not going to go into a lot of plan details, but with a Medigap plan, it's an alternative to going with an Advantage plan. You cannot go both ways. There are a lot of pros that we're going to talk about soon about Medigap. But one of the cons is it does not include prescriptions. If you get a Medigap, you also need to get a standalone prescription drug plan. So you're either getting a Medicare Advantage plan, Part C, that includes your drugs, or you're getting a Medigap plan with a separate drug plan. Is everyone still with me? Yes? Okay. So how are they different? So I'm a broker, so I represent a lot of companies. And my clients will just say, just tell me what to do. And I can't do that, unfortunately. My job is to present the pros and the cons and to bring different things up, but I'm not allowed to say I recommend this plan or not this plan. Sometimes I try and talk people out of certain plans, but it's important to understand how they work. So they're very different in terms of premiums. So with an Advantage plan, the Part C, remember I said currently it's $0 to $50 a month. It includes your prescriptions and all of that. A Medigap plan varies based on your age and based on where you live. So, and don't quote me on this, but for like a 65-year-old woman, you're probably looking at like 165 to 180 a month. And a man, because they're more needy, tend to be more expensive. Anyone like that?
No.
Okay. No. But men are more expensive. And the older you are, the more expensive it is. And then again, you would also need a prescription plan, but prescription plans now range from $0 to like $50. So you will pay more for a Medigap plan. The difference is, though, with a Medicare Advantage plan, you're paying less but now every time you use it, you're going to have a copay. A lot of times your PCPs are zero, but you go to a specialist, you have a copay. You have inpatient surgery, you have a copay. I mean, inpatient hospitalization, you have a copay. Um, Physical therapy, you have a copay. So an Advantage plan is going to cost less each month, but then you're going to, as you use it, you have different costs up to that out of pocket. Remember, up to that number, God forbid. With a Medigap plan, the way Plan G works, this plan is standardized. The benefits never, ever change every year, just like the other ones. You have to meet your Part B deductible, which is $257 this year. It will go up a little. And then you're covered in full for all your medical expenses, anything that's covered by Medicare. So you're paying more each month. You do have that deductible, but then you're covered in full. So you have a hip replacement. You need an MRI. You need to see your specialist. You need outpatient surgery. You need months of PT. You need follow-up. You're paying $257, period, for that calendar year for all of that stuff. Whereas with an Advantage plan, you're paying your specialist, you have a copay for your MRI, you have a copay for your PT. So it works differently. So you have to look at the overall picture. Now, with an Advantage plan, the advantage is you get all those dental, vision, hearing, extra things. You don't get that with the Medigap plan. It just covers your medical. Provider access. With a Medicare Advantage plan, you have a network of doctors. Some are very large networks, but I always look up people's doctors. I look up the hospitals. I look up their therapists. I look up their dentists. I look up their vision providers. With Medigap, you could go to any doctor, any hospital, anywhere in the United States that takes Medicare. I never look up doctors. You want to go to the Mayo Clinic, you want to go to Texas, as long as they take Medicare, you're covered. And this next thing I'm going to tell you is the most important thing. With a Medicare Advantage plan, anyone can get it. As long as you have Parts A and B, you live in the plan service area, and you have an eligibility period to enroll, you can enroll in an Advantage plan, no questions asked. With a Medigap plan, if you are within 6 months of turning 65, or let's say you're working and you delay your Part B, and you're within 6 months of your Part B effective date, no medical questions, automatically accepted at the preferred rate. If you do not do it then, and you go with an Advantage plan, and then 2 years later you say, you know what, now I want Medigap, they will ask you questions. They could rate you up or they could turn you down. So the time to get Medigap, if you want it, is when you're first eligible. And the reason they do that, honestly, I think like some people say, oh, I thought they're not allowed to ask questions. That's true with under 65, and that's true with Medicare Advantage plans. But the reason they do that is because everyone will go with an Advantage plan because they're cheaper. And then, God forbid, get cancer or some serious condition and want to switch. And that would drive the rates up for the Medigap to like 400 a month, 500 a month. So they do it as a way to contain the cost. So again, you can get Medigap, but you want to get it when you're first eligible. Not all brokers tell you about Medigap, so make sure you ask about it. I'm just going to keep going. I know I tend to get long-winded, so I have to stop. So star ratings, there's something called star ratings for Medicare Advantage plans and for standalone prescription drug plans. They come out every October for the year before. But what they basically are looking at is member satisfaction, the way they're paying claims. Plans are rated from 1 to 5 stars, with 5 being the best. So you want to get a plan that has a good star rating. I mean, it has to meet your needs, but the star ratings are important to look at as well. Now, I want to talk about prescription drugs. Prescription drugs work differently than they do for under 65. For people who are under 65, their plan includes their prescriptions and everything goes to the same out-of-pocket maximum. With Medicare, prescriptions are treated separately. There used to be something called the coverage gap or the donut hole, which used to be a horrible thing where people ended up spending a lot of money when they were in this period of time until they reached their next level of coverage. Luckily, the coverage gap went away. And there is a new rule as part of the Inflation Reduction Act that says a person on Medicare will not spend more than $2,000 a year for all their medications, as long as the medications are covered by the plan. So that's why it's always important to check to make sure your drugs are in what they call the formulary. But how prescriptions work, and it doesn't matter if you get it through an Advantage plan or a standalone drug plan, the rules are the same. Usually, there is a deductible that applies to the more expensive medications. So medications are divided into different tiers. Your tier ones are your preferred generic, which are your cheapest, like your lisinoprils of the world. Your tier twos are your regular generics. Your tier threes are your preferred brands, like your Eliquis, your Ozempic, all those drugs. Your tier fours are your non-preferred, and your tier fives are your specialty drugs. So for most plans, you have a deductible. The government sets the deductible. In 2025, it's 590 for your tiers 3, 4, and 5. You don't worry about your deductible for your ones and twos for the most part. But for the more expensive drugs, you have to meet your deductible. Then you pay a percentage of the medication, 25%, 40%, depending, until everything adds up to 2,000. That includes your 590 goes to that 2,000. Once you reach 2,000, as long as your drug is covered, you are covered in full for the rest of the calendar year for all your medications that are covered. Okay, just a few more things and I promise I'll be quiet. So, different times to enroll. These enrollment periods are important. There's something called your initial enrollment period. That is when you are new to Medicare. That is, remember, you're eligible the first of the month in which you turn 65, unless your birthday is the first of the month, then you're eligible the first of the preceding month. You can start the process 3 months prior. So if your birthday is in July, you could start the process in April. It won't start till July 1st. But since it takes time, it's good to start it in advance. So that is your initial enrollment period. You are new to Medicare. We talked about the open enrollment period for Medigap, where there's no questions asked. You have that 6-month period when you're within 6 months of turning 65 or enrolling in Part B. That's the best time if you want Medigap to get into it because you're guaranteed. Then there's something called special enrollment periods. You're leaving your job coverage. You move to a new state. So you have what's called a special enrollment period. It's usually 60 days where you could enroll in a new plan and it will start the first of the following month. Then you have that annual enrollment period, which is my least favorite time of year, which is every year between October 15th and December 7th. This is for people who are already enrolled in Medicare. I get calls from people, oh my God, I'm new to Medicare, but I have to sign up. It's that enrollment period. No, this enrollment period is for people who already have Medicare and want to make a change. If you're new to Medicare, you have your own enrollment period based on your birthday. And then there's a new period called an open enrollment period for Medicare Advantage. This started a few years ago. If someone's in an Advantage plan, they have one more opportunity to change their plan if they don't like it between January 1st and March 31st to a different Advantage plan. So I just threw a lot at you. I know, but I tried to give you a little bit of a lot.
One question, Nancy, I know you've mentioned this several times, but one thing I just wanted to have you emphasize again, because I'm sure it'll come up, is if you are currently employed, do you need to enroll in Medicare? You want to review that one more time for everyone?
Absolutely. And that's an important question. So if you're self-employed, yes, you need to enroll in Medicare A and B. If you have under 20 employees, 20 is the magical number. So if you're in a group with under 20, you need to enroll in A and B. If you're not working and whatever, you need to enroll in A and B. But if you are a full-time active employee in a company with over 20 employees, no, you could delay enrolling. You could choose to enroll in Part A if you want to, because there's no cost. The only reason you would not do that currently is if you have an HSA. You wouldn't want to get A because you wouldn't be able to contribute to it.
Okay. Another question, Nancy, is if we have clients that have questions, are you available? Are you taking on new clients? And when is the best time to contact you? I would imagine probably October through December is probably not the best time to reach out to you.
Totally not, unless you're eligible then. But
Right.
absolutely. And I do educational workshops in person. I usually do them at the Peters Library or the St. Clair Rec Center. And if you are interested too, like if you still have a few years, I have put people on a mailing list and I do newsletters and basic information. So if you want to call with questions or just be added to the mailing list, just let me know and we're happy to do that.
Wonderful. Yeah, as for the people that are still on the webinar, we can forward you Nancy's information, so you can use her as a resource. If you'd like to be added to that mailing list, you're welcome to reach out to us and we can coordinate with Nancy's team to make sure you're on that mailing list. Any questions, Tom?
No. Nancy, as usual, did a wonderful job. Little side note here that Nancy is my son-in-law's mother. So Nancy, wonderful job.